One of the unusual things about anorexia nervosa is that as weight loss progresses and the individual becomes thinner and thinner, their worry about weight actually increases. During the course of weight loss, the patient will frequently say they aspire to a particular weight. They have a particular goal weight in mind. They feel the necessity of reaching a certain number of pounds, but their weight never stops at that point. Because the illness is so compulsively driven, there is something about the weight loss that's enticing. It's reinforcing in some way. It creates for them a sense of uniqueness. But once it settles in, it really is the camouflage for this deep-seated, very profound sense of worthlessness, inadequacy, and the inability to meet the challenges of development. There's evidence that genetic factors play a prominent role. Children who ultimately develop anorexia nervosa have a development that is characterized by fear and worry, difficulty with change. Difficulty with change is one of the essential characteristics of anxiety. So Dr. Fusner and I are interested in studying the circuits in the brain that play a role in how visual information is processed, also how fear is processed. And the reason for both is, on the one hand, people with anorexia nervosa have a view of their body that doesn't correspond to anyone else's view of their body. Obviously, starvation will tilt the brain in a direction different from how the brain typically operates. There are a myriad of biological changes that are associated with food avoidance. These may play a role in triggering the illness in people who are vulnerable. What's generally considered the first description of anorexia nervosa in the medical literature dates back into the 1600s. It was referred to as nervous atrophy by a physician in England. The description is fairly reminiscent of the illness as we know it today. Beginning in the early part of the 20th century, there was increasing concern with the illness, actually dating back to the latter part of the 19th century. The illness in males appears no different than the illness in females. The symptoms are the same. There's some evidence that if caught early, the illness may run a less severe course in males than in females. The fair statement is that anorexia nervosa occurs in males, not as often as in females. The fraction is relatively low, and the characteristics in males match what you see in females. Treatment requires time, it requires patience, it requires diligence and skill on the part of the treaters. Many different interventions are needed: individual therapy, group therapy, family therapy, particularly when patients are young. The effects of medication appear to be moderate at best, so they by no means are an essential part of the treatment. They're used to quiet, so to speak, the anxiety, the worry, the agitation, the apprehension. I think people do recover from anorexia nervosa. It means that their symptoms have gone into a quiescent period, but they don't return.